We're ready? Okay, well, good morning. We are now nearly 2 weeks out from the Thanksgiving holiday, and we continue to see the same slow, steady downward trends in new cases, positivity rates, and hospitalizations that we have since mid-November. However, it's critical that these trends continue throughout this month and that we continue to reduce the number even further. We've made good progress over the last few weeks, but our ultimate goal is to get virus activity to a level that we can manage over the next few months. I want to take this time to thank Iowans for stepping up and doing your part, and I hope you've seen how that effort has paid off. We really can stop the spread of the virus if we continue to work together. We are eagerly awaiting the FDA's approval of Pfizer and Moderna vaccines and are optimistic that word will come by the end of this week. In the meantime, we're continuing to ensure our readiness to receive and distribute the vaccine once it's shipped. Last week, the department, DHS, and the Iowa Department of Public Health, Director Kelly Garcia provided an in-depth overview of the state's updated vaccine distribution strategy, including the approximate allocations of each vaccine that we expect to receive. Iowa is prioritizing healthcare workers and long-term care facility residents and staff in the first round of vaccine shipments. Hospitals that will be receiving a portion of the initial shipment of the Pfizer vaccine have now been notified and are making plans for how the vaccines will be administered to their workforce at their facilities. As you also heard, Iowa will be participating in the Long-Term Care Pharmacy Partnership, and that's a federal program that leverages national pharmacy chains to distribute and administer the vaccine in long-term care facilities statewide. Pending vaccine approval, we expect to begin vaccinations in long-term care facilities as early as December 28th. This week, the Iowa Department of Public Health is holding webinars with leaders from Walgreens and CVS in Iowa for local public health departments and long-term care facilities to learn more about the program and how it will be implemented. This coordination between our teams will help ease operations as the program launches and ensure its success statewide. As you also know, long-term care facilities are home to some of our most vulnerable Iowans, and doing everything we can to protect them from COVID-19 has been one of our highest priorities since the pandemic began. In addition to including them in the initial round of vaccinations, the state will also be providing a 30-day supply of PPE, including masks, gowns, and gloves, to Iowa's 432 facilities to support enhanced infection prevention protocols at no cost to the facilities. Details are being coordinated now, and distribution is expected to begin next week. The state has also, I'm proud to say, secured contract nurses from across the country to temporarily work in Iowa hospitals that are in need of additional relief and staffing. More than 80 nurses will have started by the end of this week, and we anticipate that in the coming days, a total of 104 nurses will be assigned throughout the state to work with our hospitals through December 30th. This additional staffing is being funded through Iowa Cares allocation, and it'll help ensure that we're prepared to handle any increase in hospitalizations that could occur during the holidays. Additionally, we've also increased our contact tracing resources to ensure that case investigations process continues in a timely manner for those who've recently been diagnosed with COVID-19. This week, we have had an additional 200 contact tracers, case investigators, will be providing support to the state doing case investigations for 65 of Iowa's 99 counties. And funding for these resources is also through the state's CARES allocation. Since the pandemic began, I just want to say that I have been so impressed with the unprecedented collaboration among Iowa's healthcare providers. Organizations that would otherwise be competitors have willingly come together these last 9 months to partner, all for the purpose of ensuring Iowans have the care that they need and deserve, regardless of circumstances. A few weeks ago, we tested that resolve as we saw hospitalizations climb dramatically statewide. But working together as one healthcare system, Iowa's medical providers made sure that everyone who needed care got it. And now we're about to make even that easier. Together with the state, Mercy One is establishing the Iowa COVID-19 Hospital Transfer Line. It's a centralized resource that any hospital can use when they need to move a COVID-19 patient to another facility. So now I'd like to take this opportunity to introduce Bob Ritz, who's the CEO of Mercy One, to share more information about this new initiative. Bob?
Thank you, Governor Reynolds, and it's truly a pleasure to be here. And I really want to take this opportunity to congratulate all of you. The work that you have been doing with all of us to help fight this pandemic has been nothing short of miraculous. So I know everybody wins the game on Monday morning, but we're in the game now, and we are for a long time still. But progress is on the way, and I think much of that's due to your leadership and the partnership that you referred to between our health systems here in Iowa, all healthcare professionals. The public health department has been just incredible. And it's certainly the National Guard, the media, all of us working together to give our communities a sense of hope for the future. The other thing I want to do is I want to thank all the healthcare workers that are taking care of COVID patients and those that are supporting them. You know, they're often referred to as healthcare heroes. We have hundreds of thousands of healthcare heroes all the time. But these individuals are not just stretched at home, they're stretched at work and vice versa, and you can imagine what that means after 9 months. And for 9 months, our teams have been working tirelessly to protect Iowans. And I know looking back, I think we've done an incredible job. We know the precautions are important. We ask every Iowan to remember to wear a mask, keep your distance, particularly during holidays, because it's going to be tempting, and wash your hands frequently. Hope is right around the corner. And one example of that is, in fact, this Iowa Hospital Transfer Line. Over the last 9 months, we have worked together to make sure all Iowans get access to health care. And we've had to essentially use innovation and collaboration and adjust our hospitals and our health systems to care for this very new population of patients. And I think we've done so in a very effective way. It's in that same spirit of that innovation that the Iowa Hospital Transfer Line became a reality just recently. And I should say collaboration. You know, hospitals often transfer patients to another hospital for a different level of care. And we do that all the time. But during the pandemic, with these episodic waves of infections and surges, the bed supply gets tighter. And that the difficulty in transfer a patient is remarkably different. And what happens is an individual at a hospital will make a phone call to another hospital. And they usually have those hospitals they call. But when the bed supply tightens up in urban and rural Iowa, those calls become many. And the complexity of that process can be really disheartening. So I think with the partnership that the governor's office, the public health department, the National Guard, Mercy One, and all of our health systems, we are delighted to bring this new comprehensive approach to coordinating the care of patients that have COVID diagnosis and acute care patients that also need access to care. At Mercy One, we've benefited from a hospital transfer system for years. And to this day, we, on average, transfer about 14,000 individuals. We've used the framework and the technology and the structure of our transfer center with the support of the governor, the public health department, and the National Guard, and all health systems to expand this to take care of all hospital transfers within the state with one easy phone call. Any hospital who has to transfer a patient to another hospital for a bed can use the traditional process they've always used. In the event, however, that they want to they find it difficult to place that patient, they can call the Iowa Hospital Transfer Line, make one call, and our team will take it from there. And we will work together with the Public Health Department and the National Guard. We will find the closest, most appropriate placement for that patient, and we effectively make that coordinate that transfer until it's complete. That way, our hospital teams can stay focused on their primary purpose, which is care for those individuals in need. I want to take this opportunity to thank two people on our team at Mercy One because they really came to the call. Diane Murphy and Shauna Gunn, two people who've run our transfer system for some time, partnered together with the governor's team, the public health department, and the National Guard and other health systems to make this possible. And we're so delighted for their commitment to do that. I can't tell you how pleased we are to bring this new tool to our toolkit to get through this pandemic. We're across the 50-yard line. I know we can see the end zone. We just don't know what the distance is, but we're in the right direction. And I think it's because of all of you coming together to make the state of Iowa really a showcase for how we can work to protect Iowans together. So, Governor, thank you very much for the honor to be here today, but thank you most importantly for your leadership and your partnership, and I'll move on. Thanks.
That was excellent. Thank you, Bob. Thank you, Bob. I just so appreciate your team's willingness to make this transfer service possible, and I want to thank all of Iowa's healthcare systems and hospitals, the Department of Public Health, and the National Guard, who will leverage this resource really to help benefit all of Iowans. Minutes matter when a person's health is in crisis, and this new transfer line is one more way that we can work together to get people the care that they need as quickly as possible. So I want to say thank you to you for leading this initiative. Bob, I know that you're on a tight schedule today, but I'm so glad that you were able to join us and talk about the new partnership that we have in place, and just am excited about the benefit that that's going to bring to healthcare personnel across the state of Iowa. So thank you very much. Thank you. So while we've learned a lot about COVID-19 since the pandemic began, one of the most encouraging facts is that the virus occurs less frequently in children than adults. Here in Iowa since March, children up to the age of 10 account for just 4% of all positive cases. 3% of cases occur among kids 11 to 14, and 6% are teens aged 15 to 18. These percentages have remained consistent throughout the pandemic, even since school started this fall. According to the World Health Organization, children of all ages can be infected with COVID-19 and can spread the virus to others. However, studies show that children younger than 10 are less susceptible to COVID-19 and less likely to transmit the virus, while adolescents and teens are more likely to become infected. When positive cases do occur in schools, it's more likely that the virus is introduced by adult teachers and staff. Transmission within schools occur most often between staff members, less often among staff and students, and it rarely occurs from student to student. These trends have been reported in countries across the globe, including the United States, and they're evident right here at home. Recently, Iowa's 327 public school districts, 119 accredited non-public schools, were asked to voluntarily report certain COVID data to the Iowa Department of Education, including cases and mitigation efforts. And while only a portion of the schools are reporting, what we've learned is that the situation in our schools, it is consistent with these findings. Since the start of the school year, among schools reporting, less than 2% of Iowa's K-12 students have been infected with the virus. Anecdotally, most cases were due to an exposure outside of school, either because of community spread or because of a household member was positive. There continues to be substantial scientific evidence that COVID-19 has less effect on children's health than adults, and that schools are not a primary driver of the virus transmission and spread. In fact, the CDC has said that schools are the safest place for kids to be, and that it's school closures that can have a negative effect on their health, well-being, and development. Several more studies are now emerging that suggest extended school closures, seen as a solution for virus mitigation, are actually failing students. A new study by McKinsey and Company projects that students will continue to lag academically in schools if schools remain status quo in alternate learning models through the end of the school year. The study found that students learned only 67% of the math and 87% of the reading that grade-level peers would typically have learned by fall. Students on average could lose 5 to 9 months of learning by the end of June 2021. Students of color could be 6 to 12 months behind, compared with 4 to 8 months for white students. But if schools reopen in January, the outlook is better. Then it predicts that learning loss would be less, 4 to 5 months for white students, 6 to 7 months for students of color, but make no mistake, that is still problematic. Iowa is not immune from this trend. Last week, Director Ann Lebo from the Department of Education shared that literacy screening scores decreased 21% among Iowa's first graders this fall, but we have time to turn this around. Last spring, when schools closed, it was a precautionary measure during a time when very little was known about COVID-19. But as time went by, I believe that getting our kids back to school would be one of the most important steps forward in our recovery. Thankfully, Iowa's legislature felt the same way, and they drafted legislation that I signed into law requiring that at least 50% of learning must occur in person. But 50% of in-person learning shouldn't be a limiting factor. It should be a starting point. Now we can use the knowledge that we've gained and the overwhelming evidence that now exists to get our students back in the classroom full-time and make up for the learning that they've lost. As I mentioned last week, I've had the opportunity to speak with many parents from school districts across the state this fall. Some of them have children who return to school for full-time in-person learning, and while it isn't the same as in years past, it's working, and those families are grateful for the sense of normalcy and routine. But in other areas, parents are struggling to balance working from home while assisting their children with online learning, or are forced to leave the workforce and face an uncertain financial future. And families who count on their children's school for necessary support and services may not have the assistance that they desperately need. These are the parents who are now speaking up and voicing the need for more options that make better sense for the families and students served by Iowa schools.